Today's video is discussing how to improve the stability of your knee. If you're like me and you've had on and offgoing injuries throughout your life, this video should be particularly helpful for you to improve the stability, health, and function of the knee. Proprioception, or sometimes referred to as kinesthesia, or our sixth sense, is a special ability within the body that allows us to sense where we are in space. Luckily, this ability is trainable with physical therapy, and we can enhance the function of what are called proprioceptors that specialize in this task and activity. When discussing how to improve proprioception and thereby improve the stability of the knee, the first exercise that I normally start with for home education is referred to as tandem stance, or heel to toe stance. I would recommend to have your hands really close to an object for stability, such as next to the sink. To get into some higher level exercises, the first place to get started is single leg stance. If this exercise is starting to feel a bit easy, I would recommend to get yourself either a balance mat or even a higher level would be a Bosu ball. And then proprioceptive exercise should be held for 30 seconds. To graduate into an even higher level exercise that can be done to improve stability and proprioception in the home is called single leg stance clocks. So to do this exercise, you want to stand tall on one leg, pretend like you're standing on a giant clock with 12, 3, 6, and 9, and first kicking from 12 to 6. 12 to 6. Okay, and second, from 10 to 2. 10 to 2. And 12, 6. And 10s and 2s. Glute medius strengthening is about improving the strength of the hips. The hips, not necessarily the glute maximus, like most people think of when they think of the glute musculature, not the big buttocks muscle, but more off to the side, the glute medius. This muscle is actually what helps to provide more stability to the knee. Seated clamshells. You want to sit tall in a hard back chair and bring the hips directly to the side. And back. Now there are a lot of different variations for this exercise. First variation is to just lift one side at a time. Second variation is to get more of a lift of both sides. Third variation is to use the friction of the floor, say a carpeted floor. My favorite way to do this exercise is with the use of a TheraBand. You just take the band and tie it around the legs. I would highly recommend to tie it in a bow tie. Otherwise, it's very hard to get it untied. And after you have it tied, your feet just fall directly out to the side and as you pull the band apart. If you find after a few repetitions that the band is kind of cutting into your legs, what you can do is you can open it up a little bit. It cuts in a lot less. One of the best exercises that can be done to improve knee stability in the home is called side lying hip abduction. So to do this exercise, you want to lay down on your side. You can use a pillow if you'd like. Stacking the hips is important. That means putting one hip directly above the other, and then you're raising that leg straight up towards the ceiling. Always moving slow. You want to make sure with this exercise that you're not compensating by either kicking forward with it or kicking backwards with it. If you kick forward, you're using more of your hip flexor. And if you kick backwards, you're using more of your glute maximus, your hip extensor. neither of which will help you very much with improving your knee stability. So be careful to kick directly to the side. Yet another way to strengthen the glute medius, this one being much more advanced, is called the monster walks. So this is for you individuals at a higher level who want to incorporate this as maybe part of a gym routine. So to do this exercise, you can do it without any equipment, which would just be coming down directly into a nice squat position, and then you come directly to the side. By strengthening the hamstring, you can help to provide extra stability and support for the ACL and for the knee itself. First thing to understand is that it is knee flexion that strengthens the hamstring muscle group. So anything that you do that involves bending the knee back will help to strengthen this muscle group and add a little bit more stability to the knee. One of the best ways to do it in the home is called a Romanian deadlift. You want to have a slight bend in the knee, coming directly forward, bending at your waist, arching back, coming forward. You can even work on a single leg deadlift. Same kind of idea, slight bend in the knee that you're going to be having down on the ground, arching the back, and then coming down and back. So when using the TheraBand, the first step is you want to tie a knot in one end and then come up to a door. Toss the knotted end in. From there, you tie the band around the ankle and the leg you're wanting to strengthen. Okay, and then you want to lay down. Up quickly, down slow. Up quickly, down slow. This video has all been about improving knee stability, paying particular attention to improving proprioception, hamstring strength, and glute medius strength. But there are so many different videos I could post about, so please post your comments below and subscribe so I can do my best job to create a meaningful video for you or for a loved one. This is Dr. John Mayo, physical therapist, hoping that this program is very beneficial to you to help to improve quality of life.